Compulsory English Grade 9 New Course, NEB, Unit 2 Health and Hygiene Reading. The acceleration behind telehealth services. In this interview, Chun-kai Chang, the Business Development Manager of Telehealth at Advantech, talks to News Medical about the acceleration behind telehealth services. Reporter: to begin, can you give us a brief introduction into telehealth and what it involves? Chang: telehealth is a method of providing medical care remotely, usually through video chat. Telehealth makes it possible to connect patients and clinicians from any location. It provides access to a wide range of care, including primary care consultations, psychotherapy, physical therapy, and even emergency services, by allowing primary care clinicians and specialists to further their reach in treating patients wherever there is an internet connection. The benefits of telehealth for healthcare providers and patients is that these services can be faster, safer, more effective, and less expensive in the long run, especially during a time like the COVID-19 pandemic, where telehealth has allowed access to medical care without going to hospitals to protect patients and hospital staff from being exposed to the infection. Reporter: what are some of the main drivers behind the acceleration and momentum of telehealth services? Chang: there are two major drivers for this fast-growing market. The first and most recent driver for telehealth has been the global COVID-19 pandemic. Strong social distancing and minimal physical contact precautions have pushed the shift to telehealth and remote consultations as it aids in infection protection. These precautions and increased hospital bed shortages have forced medical facilities to incorporate more telehealth technologies to keep up with demand and maintain care continuity for patients at home. The second driver is the shortage of medical professionals when demand is increasing every year due to an aging population and more patients with chronic and non-communicable diseases. For people living in rural areas, their medical demands are underserved due to insufficient resources and long distances to drive into cities for care. With this surmounting pressure, healthcare providers have started to embrace digital technology to enhance care delivery efficiency. Telehealth is one of the promising ways to tackle the challenge of doctor shortages and expand specialists and doctors' reach to patients. Reporter: in terms of this acceleration and momentum of telehealth services we are currently seeing, what are some items we can expect to see more of in the future? When it comes to remote patient monitoring for clinicians, what impact does telehealth have on this? Chang: remote patient monitoring could be one of the applications of telehealth. Remote patient monitoring usually involves continuously collecting patients' health data through wearable devices, such as vital signs and blood sugars. The patient's data is then transmitted in real time, monitored, and reviewed by medical providers. In this way, medical providers could acquire a whole picture of a patient's health condition and give a more precise diagnosis. The expansion of telehealth further highlights the role of remote patient monitoring because clinicians need the full picture. Also, remote patient monitoring could improve patient engagement, which means healthcare providers, clinicians can act as a coach and interact with patients to improve their health outcomes. Reporter: how has telehealth shaped the way clinicians work with each other? Chang: clinician-to-clinician telehealth services have enabled medical professionals to collaborate virtually with specialists in other locations to deliver treatment and care to patients jointly. This service can range from remote surgical mentoring to tele-ICU and tele-ER, like a stroke, in which on-site staff work together with remote physician, specialist team to assess patient's condition. Telehealth solutions relieve the pressure of staffing gaps seen in critical departments such as emergency room and ICU. Reporter: what would you say are some of the biggest challenges clinicians currently face with telehealth? Chang: many hospitals are still facing the lack of infrastructure to implement telehealth successfully, insufficient hardware, and the right technology for each specialty. Some hospitals struggle with reliable networking infrastructures like broadband, 4G, or Wi-Fi. This could limit the connectivity within facilities and provide remote care to rural areas or mobile clinics. Having the right technology and tools and place will be critical to successful telehealth programs.